It goes without saying that the Wisconsin Northwoods is a premier tourist destination. You'll find a lot of financially secure out-of-towners up here, living in beautiful lakeshore homes part of the year. That is in stark contrast to the locals, people born here and people who've lived here their entire lives, often in the shadows of this vacation paradise.
Currently, a lot of the jobs are in the tourism industry and in the retail area, and those typically universally have been lower paying jobs. Typically they don't have benefits, and what happens is a lot of times people up here are patching together 2 and even 3 part-time jobs in those areas in order to make a family living wage. So they're working a lot, they're not getting very much ahead, and they don't have any benefits.
People with low-paying part or full-time jobs without benefits often turn to BadgerCare, a Wisconsin Medicaid program that provides affordable health care for the state's low to moderate income families with children. BadgerCare has income limits, and many folks have been forced to make life-changing decisions just to stay eligible.
Like, I stayed working part-time so that we wouldn't go over the income limit. And if we did, then we would lose BadgerCare and all the benefits that go along with it. My husband had got a raise, and then we ended up losing BadgerCare anyways because we made too much money by like $5. So, yeah, we lost it.
We had come to the point in our income where we were paying the highest level that there was, and we were at the jump point where we were going to possibly lose it, and we did. My husband got a raise at work. He had insurance available through his employer, but our portion of paying that would have been $600 to $650 a month, which was literally, I only worked part-time. That was almost what I made. So we came to the conclusion that I was going to have to quit my job in order to keep the BadgerCare. We had one child, our middle child, had had heart surgery when he was 7 months old, so we don't have an option but to have health care. And it was tough. I went in and told my boss the next morning and cried.
Access to dental care also comes with its own challenges.
There's no one that really covers for dental, and there's a couple places in Wisconsin that you have to travel to that will take BadgerCare for dental, but it's hard to be able to drive an hour away just for a dentist appointment, or so it'd be nice if there was more dental coverage like in town here.
7 years ago when I started this program, I would say to parents, Green Bay is your closest option for BadgerCare or uninsured. Whereas now there are some offices in town in Oneida County, as well as we had mentioned earlier, the UP of Michigan was granted authority to accept BadgerCare. So again, it's still an hour drive, but gosh, it's not a 3-hour drive.
Sue Clem is a registered nurse at St. Mary's Hospital in Rhinelander. She is also the hospital's dental outreach coordinator.
We were able to secure a grant to do a sealant program. And then we've done that for 7 years now, and every year we look for funding, we get volunteers. So when, we certainly know there's an access issue, and when we started looking at the root cause of this, we thought if we can prevent cavities, then maybe we can get, the access issue won't be as terrible, if we can get down to the root cause of the cavities. Over probably the last 7 years, the program that we've had, it's been about 1,200 sealants is what we've done. I think that's about 500 or 600 kids, second graders. There is a dental shortage. There are dentists retiring far quicker than they're replacing their profession. I don't know that it would totally meet the need, but it would certainly help, if they could get that, the reimbursement that insurance pays, for example. If BadgerCare could step up to the bat with that.
As a healthcare provider in the community, St. Mary's Hospital helps ensure that the local citizenry has access to many vital resources.
What I do here at St. Mary's Hospital is work with people through the Community Link and Health Access Program. And what I do is try to plug them in and get them connected for a variety of resources. primarily health-related resources, but broadly speaking also social service programs within the community to meet their unmet needs. And that really targets somebody without health coverage or those that have underinsurance, high deductibles, again, seeing barriers to accessing health care.
Being in a rural area, certainly there's challenges regarding transportation. There's challenges regarding just getting the in-home help that some people need. And in Oneida County, it is hard to find the kind of help to come into a home at an hourly wage. You're not guaranteeing people full-time jobs, so it's hard to find those unique people that will go out into the sticks and help for an hour or two here or there. So it makes it even a bigger challenge for people to stay in their own homes.
If you've ever had to pay for childcare or know someone who has, you know how expensive it is. Now imagine yourself as a low-income parent working 3 part-time jobs. Where do you turn to for quality childcare? For many people, the answer is Wisconsin Shares, the state child care subsidy program, and a program based on income limits, just like BadgerCare.
I'll never forget, we had a family at that time that the mother had gotten, she was a single mom and had gotten a raise of $5, and that $5 would have booted her out of the subsidy system. So she actually refused the raise so that she could keep this child care subsidy.
Higher quality programs tend to either be free or very expensive. So for example, Head Start, which has many performance standards and requirements for Head Start programs, including the education of their teachers, is a free government program for low-income children or children with disabilities, but it's not accessible to the general working population.
Well, the dollars that we get in this state are through the federal child care block grants dollars that come into the state of Wisconsin, but those have been cut too, or they've been flat funded for so many years. When you continue to operate on 20%, 25% cuts, you know, every time a budget comes, it's really difficult to provide the same level of service.
Families here, like I said before, also depend on two-family income, so it's not just the women that will be affected, but families will be affected. Men may end up having to get 2 jobs, or as in some cases, the man or woman takes a job during the day and the spouse takes the job at night so that they can avoid child care costs, and the family is separated in effect. The family becomes fragmented.
I had spoken before about parents needing to be more of an advocate for their child and demand better care. The care will improve if they demand it, not only of the child care provider, but of our legislatures and our legislators, you know, and telling them, you know, that we need funding or we need better child care, and this is how we're going about to get it.